Hi, hello, welcome. Welcome to Dr. Ravichandra Official. Today we will discuss the topic cell injury. What are the causes of cell injury? Hypoxia, physical agents, chemical agents, infectious agents, nutritional disturbances, immunological reactions, and genetic derangements are the causes of cell injury. What are the consequences of cell injury? Injurious agents when there is sublethal condition leads to reversible injury. Examples accumulations and degenerations. This reversible injury when the stimulus is being removed, that injurious agent has been removed, even though it is getting deteriorated or lethal, may go into a condition called as irreversible cell reaction. It can be necrosis or apoptosis. Unprogrammed cell death is necrosis, whereas programmed cell death is apoptosis. Degree of the cell or tissue damage. The type of response is dependent on the type, severity, and duration of the injury, and the consequences depends on type, status, and adaptability of the cell. Injurious agents act on aerobic respiration, which is involved in generation of ATP, maintenance of integrity of cell membranes, protein synthesis, intracellular cytoskeleton, integrity of genetic apparatus. Intracellular mechanisms of cell injury occurs by five methods. One is depletion of the ATP. Second one is mitochondrial damage. Third one is intracellular calcium accumulation or loss of calcium homeostasis with influx of calcium. Fourth one is oxidative stress or accumulation of the oxygen free radicals. And fifth one is defects in membrane permeability. We will discuss one by one. First, depletion of the ATP or ATP depletion. Ischemic and toxic injury will lead to decreased ATP synthesis by efficient aerobic pathway and increased inefficient anaerobic glycolysis. Ischemia or hypoxia or chemical damage will cause decreased oxidative phosphorylation, which results in decreased ATP. When it falls to 5 to 10% of the normal, detachment of ribosomes occur. If, the, if there is decreased ATP, there will be decreased sodium pump functioning and there will be decreased aerobic glycolysis. There will be increased anaerobic glycolysis. So, decreased ATP will lead to decreased sodium pump, increased anaerobic glycolysis, and detachment of the ribosomes. Decreased sodium pump functioning will cause the increased influx of the calcium, water, and sodium, and efflux of potassium, thereby causing cellular swelling, loss of the microvilli, bleb formation, endoplasmic reticulum swelling, mitochondrial swelling, myelin figures formation. Increased anaerobic glycolysis will result in decreased glycogen and decreased pH and thereby causing clumping of the chromatin. Detachment of the ribosomes will occur when it falls to 5 to 10% of the normal. This results in decreased protein synthesis and lipid deposition. Next, mitochondrial damage. It may occur directly because of the hypoxia or toxins or because of the increased intracellular calcium. Injury will cause activation of BAK which chops up the mitochondria into vulnerable little spheres. Another protein backs then pokes countless holes in those spheres. This results in high conductance channels that loses the protons and energy. Damaged mitochondria leaks, spilling their pro-death contents like cytochrome C into the cell, which will promote the apoptosis, that is programmed cell death. As I said earlier, mitochondrial dysfunction or injury because of the oxidative stress or lipid peroxidation or increased cytosolic calcium will cause decreased ATP production, thereby activating the cytochrome C and the release of protons, and thereby causing mitochondrial permeability transition and cytochrome C and the apoptotic proteins production and mitochondrial membrane damage, leading to apoptosis. Third one, loss of calcium homeostasis or increased intracellular calcium. Normally, intracellular calcium will be very low. Ischemia and toxins will cause the influx of the calcium. Increased calcium will activate the enzymes phospholipases, proteases, ATPases, and endonucleases. These enzymes activation will result in the membrane damage, cytoskeletal damage, loss of ATP, and DNA damage. This is shown in the picture. Extracellular calcium, and because of the hypoxia or toxic conditions or the injurious agent, there will be increased cytosolic calcium, which is activating the enzymes endonuclease, phospholipase, protease, and ATPase. Because of the activation of this endonuclease, there will be nuclear chromatin damage. Because of the phospholipase activation, there will be cytoskeletal damage. Because of the protease activation, there will be reduction in the phospholipids. And because of the ATPase activation will cause decreased ATP. Cytoskeletal damage and reduction in the phospholipids will further deteriorate and cause membrane damage. Fourth one, initiation of free radicals. Absorption of radiant energy will cause dissociation of the water into H plus and OH minus ions. Metabolism of these exogenous chemicals like carbon tetrachloride will cause the production of free radicals. There will be normally oxidation reduction reactions during the normal metabolic process, thereby resulting in formation of superhydroxides or superoxides, hydroxyl ions, hydrogen peroxide, which are all free radicals. Transition metals like iron and copper mediated free radical injury will happen. Hydrogen peroxide, when combined with iron, Fe plus 2, it is will result in Fe plus 3 plus hydroxyl ions, which is a Fenton's reaction. Nitric oxide, NO, can act as a free radical and it can be converted to peroxynitrate, ONOO minus. What are the effects of these free radicals? Because of the production of the free radicals, there will be lipid peroxidation of the membranes, which is autocatalytic propagation. Modification of the proteins will lead to the fragmentation and damage to the new DNA because of the nuclear and mitochondrial damage. Inactivation of free radicals can be done with the help of the antioxidants like vitamin A and vitamin E. Transition metal binding and transporting proteins like ceruloplasmin, transferrin, lactoferrin. Free radical scavenging enzymes are catalase, superoxide dismutase, and glutathione peroxidase. So, with the help of these antioxidants and metal binding and transporting proteins and scavenging enzymes of free radicals, there will be inactivation of the free radicals can be achieved. So, in a nutshell, free radical production, inactivation, and damage. So, all P450 oxidase will be there. There will be NADPH oxidase will be there. Oxygen will be there, and many respiratory chain enzymes, cytosolic enzymes, and oxidase enzyme within a cell. With the presence of superoxide dismutase, there will be production of the hydrox superoxide, which is converted to hydrogen peroxide. In the presence of catalase, there will be release of water. This hydrogen peroxide will convert to hydroxyl ions in the process of Fenton's reaction, converting the Fe plus 2 to Fe plus 3 ions, and there will be reduction. Glutathione peroxidase and glutathione reductase enzymes will help in this reaction. And finally, due to the inactivation and thereby over-reactive free radicals, there will be lipid peroxidation, protein damage, and DNA damage. Now coming to the reperfusion, injury, and free radicals. Toxic oxygen species are generated during reperfusion, hence the term reperfusion injury. This has clinical relevance since reperfusion of heart muscle is commonly achieved with percutaneous angioplasty. Those patients who are reperfused after more than 20 minutes post-infarction are at a risk for reperfusion injury. Characteristics of the irreversibility or irreversible injury. Failure to reverse mitochondrial dysfunction even after resolution of injury. There will be lack of ATP. Profound membrane damage with dysfunction will result in escape of the intracellular enzymes. It is recognized morphologically as cell death, necrosis. Mechanisms of membrane damage. Mitochondrial dysfunction and increased cytosolic calcium will lead to membrane damage. Because of the mitochondrial dysfunction, there will be decreased phospholipid synthesis, which will cause phospholipid loss and resulting in membrane damage. Increased cytosolic calcium also causes phospholipase activation and protease activation, which will result in lipid breakdown products and cytoskeletal damage, further resulting in membrane damage. Mechanisms of irreversible injury in a nutshell. Injurious stimulus, when given, there will be oxygen free radicals production, increased intracellular calcium, membrane damage, loss of ATP. Loss of ATP results in loss of energy dependent cell reactions. Membrane damage causes plasma membrane loss of cellular contents, and lysosomes enzyme digestion of the cell contents, and mitochondria there will be cell death. And oxygen free radicals and increase in the intracellular calcium will lead to protein breakdown, DNA damage, and lipid peroxidation. Chemical or drug injury caused because of the drugs and chemicals. Those acting directly by combining with critical molecule or organelle. Mercury chloride binds to sulfhydryl groups of cell membrane. Cyanide will cause the inactivation of cytochrome oxidase. And the drugs and chemicals, those that require activation or biotransformation. Example, carbon tetrachloride forms CCl3 free radicals, and acetaminophen forms highly toxic metabolites. Morphological changes seen in reversible injury. Microscopically, there will be cellular swelling, acute cellular swelling, hydropic change. When it is grossly described, it is called as cloudy change, is the earliest manifestation of reversible injury. There will be sometimes fatty change also. Ultrastructural changes. There will be mitochondrial swelling, swelling of the endoplasmic reticulum. Because of the swelling of the endoplasmic reticulum, there will be dissociation of the ribosomes and there will be plasma membrane alterations and thereby causing blebs and myelin figures formation. This picture shows how a normal cell when it is going for a change, reversible cell injury will cause first hydropic change, then deposition of the fat further will cause fatty change. And ultrastructural can be seen by electron microscopy findings like endoplasmic reticulum swelling, mitochondrial swelling, and ribosomal dissociation in this picture. So, with this, we have completed reversible injury and irreversible injury. In a nutshell, what are all the morphological changes that are going to happen in a reversible injury and irreversible injury? We will discuss. In a reversible injury, there will be cell membrane bleb formation, and in a irreversible cell injury, there will be large cell membrane blebs. In reversible injury, there will be swelling of the endoplasmic reticulum and mitochondria. In the irreversible cell injury, there will be swelling of the endoplasmic reticulum and detachment of the ribosomes and loss of ribosomes, rupture of the lysosomes, swelling of the mitochondria with formation of amorphous densities. Myelin figures will be formed under the cell membrane. In a reversible cell injury, there will be clumping of the nuclear chromatin, whereas in irreversible cell injury, there will be nuclear condensation. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more pathological videos.